My name is Florence Uchenna Okelu, a public health nurse from Health Visiting Unit, Community Medicine, UNTH Ituku-Ozara. I'm here to present to you the topic of breast self-examination. What is breast self-examination? Breast self-examination is screening technique that we use to examine ourselves, our breast, at home. It is very important that the individual do breast self-examination at home, because 4 out of every 10 of breast cancer is being diagnosed from breast self-examination. Why do we do breast self-examination? To check for abnormalities in the breast, for lump, for changes on the breast, the contour, the size, and discharges. And when are we supposed to be doing this breast self-examination? We do breast self-examination once every month. It is very important to check ourselves to be able to detect all these abnormalities. And when there's abnormality in the breast, we don't need to be worried or anxious about it. We have to be calm. First of all, we take notes of all the changes that we'll be able to detect on our breast. Then try as much as we can to see a doctor or a nurse practitioner close to you in a good hospital. If you are still menstruating, it's always good to do your breast self-examination few days after your menses, so that the hormonal changes in the breast during menstrual period must have gone down. If you are menopausal, you have to choose a date in every month to do breast self-examination. We have different steps and methods of doing breast self-examination. You now look at the screen. The first one is by stripping yourself to the waist. Then put your 2 hands on your hip. When you put your 2 hands on your hip, you look down to look at your breast, to check for the size of the breast, the color, the contour of the breast. After that, you will put your 2 hands on your head, like this is on the screen. There you now shake your breast and check the movement of the breast to see if the 2 breasts are moving in the same way. You check for the size to know if there's anyone that is bigger than each other. Then check for the color of the skin, the size, the contour, and the color, and check if there's any swelling on the breast. If there's any swelling, you note it down, have a record, so that when you go for your checkup, you see your doctor or your nurse practitioner. Then after that, the next step, putting one hand, your left hand on the back of your head. Then using your right hand to check your breast. While you're checking your breast, you press your breast from the top down to the nipple, then circularly to the axillary, the armpit, because the breast tissue is coming from the axillary to the breast. Then you go down under the breast. Check if there is any depression, any dimple, any bumps. If there's any, you put it down and the date. so that next month, by the time you check again, you'll be able to know the difference and then be able to report to your doctor. The first step, you put your right hand on your head. Then you check the nipple of the breast. After checking the nipple, you have to press the nipple to check if there's any discharge. Reddish, yellowish, greenish, any form of discharge. And check whether it's smelling, because this calls for an attention. It's a worrisome condition that we need to see a doctor. All breast lumps are not cancerous because most of them are benign changes in the body. But it's good to check, and when you find it out, you'll be able to remove it, and that will be okay. Then the fifth position is lying with your back on the bed. Then put your one hand on your head. Using the other hand, press deep and then put pressure on the breast to check if there's any dimple or any lump. When you have done this, you now switch over and then put the other hand on your head and then check the other breast. When you have done all this, you now put them down. It's always good to have your diary where you record your findings. So it's always good to always do as breast self-examination. You don't just leave it like that. It's good to go and see your doctor. And then breast self-examination is not enough. Routine clinical checkup is very important, and annual mammogram is very important. Clinical checks will be able to help dictate all the abnormalities in the breast, and early detection gives good prognosis. Thank you very much for listening. My name remains Florence Uchenna Okelu. If you have any questions, please, you can call on the numbers on the screen. Then you can visit any nearby healthcare to allay your anxiety. Thanks very much.